I think we've made huge progress in understanding the needs of children in the context of emergencies. And in the last decade, there's been a huge increase also in an awareness of potential interventions. But where we're really failing is matching the magnitude of the need, matching our ambition to our capacity to deliver. I think the most important thing now is really taking what we know about effective programmings and really mainstreaming that into broader systems interventions that really develop capacity at the country level.
And the single biggest thing that we could do to address this epidemic, to tackle the epidemic, is for the international aid communities, the humanitarian agencies, to stop competing against each other in providing services and to start working together much more effectively. We know how to deal with trauma. We have a global challenge ahead of us, and we have to work together in order to address that challenge.
I think the key to responding to that challenge is that we need to go beyond the scope of our current limited programming to be able to equip members of families and communities in affected settings to be able to directly support and protect the children and adolescents that they are responsible to and care for.
Okay, so for delivery of mental health and psychosocial support programs for children, I would say one of the challenges is lack of trained human resources and provision of specific child-focused mental health interventions. And one way to overcome this, or one of the approaches, is to what extent we empower children themselves. I remember one of the programs that we have been working on recently is how we train the school children themselves on peer counseling. So we train children to be a peer counselor for other children, mainly in a group context, but also with some individual support skills.
Although there's some absolutely brilliant examples of MHPSS programming happening, what we need to do is bring this to scale, given the size of the challenge. And to do this, we need to work much better together, so not in silos, and we also need to look at cross-sectoral programming, so making sure that we are integrating MHPSS programming within other sectors such as education, nutrition and health.
I think from Save the Children's perspective, in the Middle East region in particular, the biggest single challenge at the moment is the lack of service providers, frontline staff who are well equipped to deal with the mental health need that the children are coming up with. So basically parents come to us looking for help, or our staff are even troubled and stressed by the level of mental health need in the communities that they work in, and we have no one else to refer to. So the biggest challenge for us is, who do we go to when those needs are so large and so significant in terms of mental health and psychosocial support? And the single, innovative way of responding to that is that we need to work across agencies with donors in a collaborative effort to strengthen national capacity, which means professionalising skills. It means working with communities to ensure that they have the right knowledge and experience and confidence to work with children who have more severe or moderate mental health needs.
Now, well, the one of the major challenges working with adolescents is lack of fund, with is really affecting the continuation of the program and working with them. The other is the ongoing conflict is affecting the whole community and affecting the life of adolescents and the children, and would be a very terrible effect on their life and their future, because they are the hope for the hope for our generation and the hope for our community. So we should take care of them in a better way. The approach that I think is more relevant, the one that I talk about, is a holistic approach like mind body medicine that we did and we practice in Gaza for 13 years.
The biggest challenge what we had is that we succeed to help many hundred children in this area in Iraq or in Kurdistan, and the biggest need what we have as a Jian Foundation is that we need trained people, trained psychologists, and this is for a long term. If we get this help. And if we organize more training, we will succeed to realize a society in peace for peace.